how it's over.
Hi everyone, my name is Dr Iwiyisi. I'll be speaking to you on IVF today, which is in vitro fertilization. I'm a medical officer with Trucare Fertility Clinic in Victoria Island, Lagos. So let's start. What is IVF? In vitro fertilization. This is the fertilization of an egg and a sperm outside of the body. Naturally, in getting pregnant, fertilization happens in the tubes. So when this process is done outside of the body, it's called in vitro. So in vitro fertilization is when we fertilize eggs and sperm outside of the body. Now, how do we go about getting these eggs? These eggs can be gotten from the woman who is trying to get pregnant, or it could also be gotten from somebody else. In this case, we could refer to that person as a donor. So why do we do IVF? Why do couples opt for IVF? In couples that find it difficult to get pregnant for any reason can decide to do IVF or have genetic problems. So we'll talk about the common indications or reasons for people doing IVF. The commonest amongst them is people with tubal problems. The uterus has a tube, and that's where fertilization happens. So if for any reasons the tubes have been damaged, then you may need to do IVF. People that have medical conditions like endometriosis. Endometriosis is a condition where the womb lining that is found within the womb is found somewhere else. And as such, there may be problems with tubes and fertilization happening naturally. So such women will need to do IVF. Other reasons why people need to do IVF include people with fibroids, people that have had their tubes tied or ligated for any reasons, people who have infertility that cannot be explained, people with genetic problems, people who would need to go cancer treatment and as such need to keep their eggs safe before they take drugs that would damage or affect their fertility. So such women should do IVF. Now, having said this, it's important to know the stages of IVF. In order to fertilize an embryo, there are different stages. First, the couples will need to get investigated. So people who have infectious diseases need to be screened for infections, HIV, syphilis, hepatitis. This can be transmitted from mother to child. So we need to get them screened for such infectious diseases. Secondly, you need to have an ovarian reserve testing. Every woman is born with a number of eggs, and these eggs get exhausted with time. So we need to know how much of those eggs they have in their reserve. And this we do by doing several tests. Amongst them is a hormone profile, which will screen out for LH and FSH. We also will do a AMH screening in some cases. AMH is anti-Mullerian hormone. Also, we'll do an ultrasound scan. An ultrasound scan looks at the ovaries. The ovaries are the organs where the eggs are located. So we need to look at the eggs, the ovaries, and see if there are eggs in them. Also, we need to do a semen analysis to look at the husband's semen or the partner's semen to know if they are good enough, if it is good enough to be used. Semen analysis is usually done after 2 days of abstinence according to WHO. Then we need to do a practice or a mock embryo transfer. Before we commence the IVF process, every woman is taken through a process called a dummy embryo transfer. This will help us gain access to the cavity to see how easy it is to pass a transfer catheter into the womb lining. Also, we also do sono HSG. Sono HSG assesses the cavity by passing saline or water into the cavity to watch out for expansion in the womb cavity. After doing this, then we can prepare the woman to have an IVF cycle. Usually, an IVF cycle takes about 3 to 4 weeks, and we start with egg preparation or ovulation induction. The woman is given some drugs, mostly hormonal drugs, to stimulate the growth of the eggs. And once the eggs are ripe or matured enough, we trigger the eggs to cause an ovulation. Having done these initial investigations or preparation for every woman who desires a child, then we'll talk about the steps which are involved in the IVF. The major step which is involved is ovulation induction. These are a series of steps in which the eggs are prepared to maturation. Women are given hormonal drugs to stimulate the growth of the eggs, and once the eggs are matured enough, they are brought out of the body and they are fertilized. After fertilization, or on the day of fertilization, we retrieve the eggs. Egg retrieval, this is usually done in a well prepared lab or theater. The eggs are retrieved under ultrasound guidance and they are taken into an embryology lab where they are checked out for matured eggs. After the eggs are retrieved, they are fertilized. Fertilization usually happens on the same day as egg retrieval, and the partner or husband is asked to produce a semen sample which we'll use to fertilize. Sperm is usually gotten by masturbation or sexual intercourse. However, there are other methods of getting sperm out of the testes. The commonest among them is TISA. TISA stands for testicular sperm aspiration. It's usually done in men who have obstructive azoospermia, in which the sperm is produced but there's a difficulty getting it out of the reproductive organ. After fertilization of the egg and sperm to generate embryos, these embryos are incubated for 5 days, and on the 5th day, usually the best 3 are transferred into the uterus. Usually we transfer 3 here. However, for certain medical or personal reasons, lesser embryos can be transferred. It's important to note that though pregnancy is a good thing, it has its attendant risks. So we have to weigh the good and bad in determining the number of embryos to transfer. Having said all this about IVF, in vitro fertilization, it's important to know the risks that are involved in IVF. The commonest of which is multiple births. I said earlier that 3 embryos are usually transferred during the process of embryo transfer. So if you have more than 1 implanting, you could have more births. And with multiple births, there is attendant risks. That is the commonest risks associated with IVF. Another is ovarian hyperstimulation. This is common in women who have a lot of eggs or who are predisposed to having a lot of eggs, such as women with PCOS. Usually, it's a mild form that we experience in most cases of IVF. This is usually not common. In over 200 cycles, we have less than 1% of clients developing OHSS. Also, there are common side effects that could occur, such as egg retrieval complication. During the process of retrieving eggs, you could have minor bleeds, minor bloating, vomiting, nausea. After the procedure, what should you expect? You may observe little pain here and there. This is usual because if your eggs have been stimulated, the ovaries may still be enlarged. So what should you expect after the embryo transfer or after the IVF procedure? Most women will require some rest, though this is not compulsory. Some women decide to take some days off work to allow some time to rest, having done a very stressful procedure. Reproductive history. Women who have had children before have an increased chance of having a successful IVF. This is not to say that women with long years of infertility cannot get pregnant with IVF. But we're just saying that from studies, it's been found out that women who have had multiple births have a higher chance of having a successful IVF. Now, the cause of infertility also determines the success rate of an IVF. IVF that are caused by tubercle factors have an increased chance of success with an IVF procedure. Lifestyle modification. In fact, people who smoke are known to have reduced number of eggs and reduced success with an IVF. So lifestyles such as smoking are discouraged. High caffeine intake are discouraged to aid the success of an IVF procedure. Having said all of this, what should you consider after an IVF procedure as a couple? After doing a successful IVF, there are things to consider. Do you want to discard your embryos, or do you want to have them stored for future IVF procedures? Embryos could be stored or discarded. For those who want to have their embryos stored, it's important to note that only high-grade embryos can be stored. And after storage, not all embryos are viable after thawing. So these are factors you should know before deciding to store your embryos after an embryo transfer. And for those who have achieved their family size and want their embryos discarded, you just need to inform the clinic to discard your embryos, and this will be discarded. Having said all of this, it's important to have a recap. We talked about IVF. It's called in vitro fertilization because the fertilization of the egg and sperm happens outside of the body. Also, we talked about the risk factors or why people do IVF, the commonest of which is unexplained infertility. We talked about endometriosis being a possible cause of reasons why people do IVF. We also talk about tubal factor, tubal blockage, or prior sterilization being a reason for people to consider IVF as an option. In some centers, women who are above 40 should consider IVF as a primary treatment of infertility. Thanks for watching. See you next time. I remain Dr. Iwiyisi, your fertility doctor.